things that impresses me the most about Lieutenant Governor Rutherford is the unique perspective that he brings to issues, and mental health is no exception to that.
Because of my position, the types of programs and events that I go to tend to have to do with behavioral health issues. And I've seen the Lieutenant Governor on numerous occasions address those audiences, speaking to the needs and the concerns of the behavioral health community.
He has always been someone who we have spoken with, we have reached out, he's reached out to us, we've reached out to him with questions and concerns about what's going on in the state regarding mental health and substance use. He's definitely someone who, it means a lot to him. He wants to understand, he wants to know what is going on and how we can make it better.
It's very clear to me that he is dedicated to advancing the needs of those who have behavioral health conditions and those who care about them.
I would say that I've become more aware of how complicated, quite frankly, how complicated the issue is. I had looked at it more from the standpoint of adults with mental illness, some experience in the past, not understanding all of the components that then leads to all of the stakeholders, and then just the whole distinction of why we consider behavioral health and even the terminology of behavioral health different from physical health.
He knows what questions to ask. He understands what many of the issues are, and when he doesn't, he asks for more information.
Lieutenant Governor Rutherford's leadership style as one where he assembles a group of individuals in the circle, realizing that each of them is bringing deep expertise in all these areas, but he knows how to seek out the expertise and to surround himself with the expertise, and then to listen to the advice of the individuals and then make the appropriate decision.
It's not just the individuals with mental health issues that are suffering, it's often the family members. And the Lieutenant Governor has done an amazing job of highlighting the fact that family members need support and help too. And in getting the resources they need, they can ultimately help the loved one that they're concerned about.
His presence and his insight, his vision has been a huge shaper of the way that we have utilized this very critical funding, which has really helped to catapult and continues to allow Maryland to stay in the lead in the nation in managing opioid-related disorders.
Through his work on the opioid task force, he saw how linked together mental health was with substance use, that really so many people who have a substance use disorder also have a co-occurring mental health disorder. So he wanted to look more in depth at that, and that is one of the reasons why he created the Behavioral Health Task Force. And it includes people from all across the state. Definitely stakeholders that include people who work at the state level, who are decision makers, policy makers.
The main thing is that it's not something to be ashamed of. And it is something that you should feel free to discuss and talk about, and of course, seek help. And there's help that can be provided.
He is very kind, and he is truly compassionate.
And that is really what I think at the end of the day, a superb leader is supposed to do.
So I truly believe that he's a champion for behavioral health in the state of Maryland.
I think we need more leaders, who are caring, who are empathetic, who obviously has a set of skills to enable them to get the job done, who is not threatened by surrounding him or herself with individuals who also have those same attributes, and who at the end of the day are about enabling individuals and communities to turn on lights that they did not know they had the power to flip the switch. And so compassion and empathy and being a servant leader is really what distinguishes, in my view, the real leader.